good. Stress is very good.
Stress is good.
Yes, stress is very good because as a normal human being, you cannot avoid stress. You cannot live without stress. That's why the definition of mental health has a key word that you cope with daily life stressors. So daily life stressors are like getting married, going to school, coming to work, being a student, being employed, driving in Kampala traffic, dealing with the potholes, the floods. All those are daily life stressors. Now, these are things that you should be able to deal with.
And cope with
properly. However, stress becomes bad when you are unable to cope with those daily life stressors. And then your body start to react to those stresses, the stressors that you're faced with. And the reaction, like your question now goes to when your body reacts, there's a response that you feel. Lack of sleep starts to come.
Policy Digest. I'm Charo Justin Safari, and today we are going to tackle an issue that is most people have called a silent emergency, and that is mental health. So according to the 2025 State of Uganda population report, launched in February 2026, 1 in 4 Ugandans are facing or experiencing a mental health condition. And the 2024 census shows that 12% of Ugandans aged 10 and above live with a probable psychological distress. Mental health is just not a personal struggle. It is a public health issue. It is a social and development issue. And today, to tackle this challenge, or what people have called a silent emergency, I'm joined by Grace, clinical psychologist and a mental health practitioner, to help us understand what it is about mental health that we should start addressing. Thank you very much for joining us. Could you kindly tell us a bit about yourself and the work that you do?
Thank you. Thank you very much, Safari. Thank you for having me. But most importantly, thank you for giving attention to this very pertinent topic that is mental health. And I like the fact that government is starting to wake up. Yes. And like you rightly quoted, the Uganda Population Status Report now gave us a name, the silent emergency. So thank you. Thank you for giving time and attention to digest and look into the silent emergency. Like you well stated, my name is Grace Obalim. I am a clinical psychologist by training. I'm a mental health practitioner. I've been in the field of mental health practice for about 12 years now. I'm a graduate of University of Nairobi, Masters in Clinical Psychology, and Nkumba University, Bachelors of Psychology, Guidance and Counseling. I currently work with an NGO that is called TPO Uganda. Yes. It's a national mental health-based organization that provides community-based mental health services across the country and to refugees. So we do comprehensive mental health services at community, not at institutions. So we provide services. I am their technical lead. I am the mental health technical lead for TPO Uganda. Other than that, I am very passionate about mental health. I am an advocate for mental health service delivery, system strengthening, and policy. So largely for the past 5 years, I have largely been around national coordination and advocacy on system strengthening and service delivery for community-based other than institutional service provision. We have a coordination and an advocacy platform that is called the Uganda National Mental Health and Psychosocial Support Working Group. It brings together all the civil society, government, directories, ministries, institutions of learning who do mental health in this country. So I coordinate that that working group as the national coordinator for Uganda. And I support, now this is my professional bit, I support the Uganda Clinical Psychology Association for all clinical psychologists in Uganda. I'm the general secretary and I'm a board member. So briefly, professionally, that's who I am. I'm a mother of 2 amazing, beautiful daughters. One is out there. I had to come with her. We are having Mother's Daughter Day today, so I will be driving around with her. I'm married to a very amazing, I think one of the best Ugandan. So I'm a sister, I'm a friend. But above all, I'm a mental health practitioner, yes, and an expert, yes. Thank you.
So what drew you into the work that you do?
What drew you
into it? What
drew me?
you?
What drew me into mental health? I like that. So I come from Gulu, from northern Uganda, and I grew up in Gulu, in Lacho, and in an extended family. And growing up, I had an auntie. Those days when I was still very young and when the HIV/AIDS treatment was still very, very limited, she would be moving within the community, supporting the community members who were suffering from the disease.
HIV.
Yes. And she would be talking to them, encouraging them, washing their clothes. She was not learned. And I grew up hearing people call her counselor. And they would refer so many people to her. So I admired what she was doing. And I told myself, when I grow up, I want to be like Auntie Margaret. So my inspiration comes from there. So I grew up feeling like I want to be able to help people, listen to people, address people's challenges, and provide a hand that no one is there is giving. So that defined my direction. When I finished high school, primary 7, is when I got to learn that no, for her, she's not actually a counselor. It's passion that makes her do that. So I got more driven to, I'm like, wow, this is amazing. So when I joined high school, I got to learn that you can actually study and become a professional that can just listen and help people. So that's what drove me to do my degree in psychology. Guidance and counseling. And as I was at the university, I met one of my lecturers. May his soul rest in peace. He died out of COVID, during the COVID-19. So he inspired me, told me, when I spoke to him and he noticed my inspiration is more about understanding people's behavior, why do people do what they do, and how can they be supported. So he told me, you can master in clinical psychology, and that is an abnormal branch of psychology, and you'll understand the disease of the brain, and that's mental health, and you know how you can be able to help people. And I'm glad I took that direction.
And they are all proud of you.
Yes, they are. They surely are. Yes.
So, would you say that Uganda is in a mental health crisis, and what stand would you take, and why?
I would say we have been at a mental health crisis for quite some time now,
yes,
as a country. And after COVID-19, in 2024, there was outrageous, they published something that they said 14 million Ugandans are mentally healed. And one of the legislators in parliament made a statement that by 2025, 50 million Ugandans will run mad. And that was showing the state of emergency that we were in when we speak about mental health. And why do I say we have been in a state of emergency in regards to mental health for quite some time? There are so many things that happen around us that when you, from a professional perspective, when you look at it, I say, okay, if this was addressed, if people's psychological status were managed, if people understand what they're feeling emotionally, if there was more clarity in regards to what are the services that are out there, this wouldn't have happened. So if you look at Uganda, where we are right now, It was in 2019. That's when the Mental Health Act was passed.
Yes.
It came in place after over 50 years of no new policy, 2019. The act came in place. You cannot implement an act without supportive documents. And policies. And up to now, we don't have a mental health policy to guide and support
how the act should be
put in place and in practice. The ministry is still somewhere trying to produce for us a national mental health strategic plan.
And they
haven't. Okay. So, and when you come to civil society, we largely work with global guidelines, global standards, global guideline. Uganda does not have a national guideline or even a minimum service guideline in regards to provision of mental health. It's just the Mental Health Act that does not even have the supportive tools that it needs for its implementation. So that is one of the reasons why I would say that we're an emergency.
Yes.
Other than that, if you look at the services, the Mental Health Act decentralizes mental health service delivery. It puts it within the primary health care structure, meaning up to Health Center 3, you should be able, Safari, to walk to an Health Center 3 and find a counselor, employed counselor, not a nurse.
A nurse does not provide mental health services.
Not a nurse acting as a counselor. You should be able to find a designated counselor at Health Center 3 to be able to support you. However, it's in paper. Largely, 2 weeks ago, you had the executive director of Butabika send out an outcry of the overflow of walk-ins into Butabika. Butabika is a national referral hospital
for mental health. And it's also a teaching institution. It's supposed to be having minimum severe cases that cannot be handled within the regionals and the district hospitals. So you have talked of severe cases.
Yes.
And so an ordinary Ugandan who is maybe hearing mental health for the first time, how would you define mental health to them? And people who also think that mental health is someone being mad. If I say I have a mental health issue or condition, they will immediately take me to the severe bracket. How would you make them understand?
You'll start saying, Safari has lost it.
She's mad.
she's I rarely use the word mad.
But it's the word
yes,
people
but
quote and
it's
use.
the common word that we all use, and it's the most simplest way that people seems to relate it to mental health, but it's highly stigmatizing.
Yes.
Now, mental health, surprisingly, is not madness. Mental health is your ability, as defined by WHO, it is your ability as an individual to be able to know your potentials, know what you can be able to do and what you cannot do. That is your potential. You can be able to cope with the daily life stresses, the challenges that you face as a human being, as a person. You're able to cope with them. And as you're coping productively and positively, you're working and making a positive contribution to yourself and the people around you. Now, that is mental health. Is a normal health state of you functioning, being able to take care of yourself, cope with stress, support people around you, support your environment. That is mental health. Now, the other end of the mental health, we have the extreme end of what they call the mental health disorders or the mental illnesses. Now, that is where a majority of us come in. The mental illnesses, these are a wide range of diseases, I would say, or disorders that affect your mental health.
Okay.
And they're in several clusters. We put them in clusters. We have mood disorder, which the most common example I would give is depression. We have anxiety disorders, which the most one is anxiety, the unfounded worry constantly. And then we have what we call psychotic disorder, which is now a mental health disorder that comes with loss of touch with reality. A person loses touch with reality. And now that's what presents with majority of what many people refer to as mad, because they had lost touch with reality. We have personality disorder. We have eating disorders. So there are quite a number of mental illnesses that affects a human being. So key word that I would maybe want you to take is that mental health is your wellness, is your normal state of functioning that you should work towards maintaining, being okay, being fine. Then the mental illness is the disease that affects your mental health. Yes, and when it comes, you should be able to address it. You should be able to get treatment, just like when malaria gets you.
And you don't get treatment.
Yes.
So you've talked of the bracket of mental health. How am I able, as a normal Ugandan, ordinary Ugandan, able to differentiate normal stress and a mental health disorder? At what point do I know that I think my mental health is starting to be affected, or I may be going into the bracket of mental health illness?
Yes. Okay. Thank you. So stress is good. Stress is very good.
Stress is good.
Yes, stress is very good, because as a normal human being, you cannot avoid stress. You cannot live without stress. That's why the definition of mental health has a key word that you cope with daily life stressors. So daily life stressors are like getting married, going to school, coming to work, being a student, being employed, driving in Kampala traffic, dealing with the potholes, the floods. All those are daily life stressors. Now, these are things that you should be able to deal with.
And cope with
properly. However, stress become bad when you are unable to cope with those daily life stressors. And then your body start to react to those stresses, the stressors that you're faced with. And the reaction, like your question now goes to, when your body reacts, there's a response that you feel. Lack of sleep starts to come. Loss of appetite starts to come. Change in your mood starts to come. You start to withdraw from people. Sometimes you lose interest in the things that you used to enjoy, okay? You start feeling low or negative about yourself. Now, when you start to feel some of these, the sluggish general body weaknesses, sickness in and out, you go to hospitals and they test and there's nothing.
But for you feeling sick.
Exactly. The doctor will tell you it's fatigue. Go and rest. That is your body telling you that your mental health is not working well right now. You're getting into the health of it and you're not coping well with stressors. So for any Ugandan out there, when you start to feel these signs, losing interest, feeling a bit low, changes that you used not to have, when you notice changes in your ability that you used not to have, that is your body reacting. So it's important to seek help.
So those are the signs, and for you to feel like that is an alarm, your body calling out for you.
An abnormal change in a behavior or in your character or in your mood, abnormal change in at your social interactions, withdraw, you're not interacting well, economically, excess spendings or low spending. So any abnormality, a behavior that you used not to have before, a behavior that you used not to notice before, and then you start to see it coming. It's important for you to start asking questions, where could this be coming from? Because those change could be telling us that something is not right with your mental health.
Okay, so let us a bit make the lens of mental health slightly and turn it to women. Women are part of the, I could say, vulnerable people in society, and they are probable to very many stress factors, as we know, a woman's life structure. So where do women fall in the conversation of mental health?
At the center. That's how I want to start. I want to start to say at the center because by God's nature and naturally, women are very highly empathetic. Empathy is being in another person's shoes, feeling what the other person is going through and being able to look and find that if it were me, what would I do and how can that be done to me? So they are at the center when we speak about mental health, but unfortunately, they are also most prone to mental health challenges because of the nature that they are. And I normally highly attribute it to society norms, values, and morals. In Africa, we believe that I'm a woman. I should not be able to speak with my voice out. I should not be able to question my husband. I should be able to be 100% submissive, get my salary declared fully to my husband. Now, that is what the norms and the perception of the society that what it has. And unfortunately, to a larger extent, it's still being practiced out there. Now, that's why it makes women more prone to mental health related challenges. But I also want to make this clear that when we speak about mental health, we look at both men and women because mental health affects everybody equally. However, we have those who are more at risk over mental health challenges, and those are women due to domestic violence, due to natures of who we are. Monthly periods, the crumbs, when they come with the pain, you don't have for example, a young girl that is just starting, they don't have someone to talk to. It will cause a psychological state. It will cause panic. It will cause fear. A man will not go through that. Look at childbirth. Childbirth also has a mental illness attached to it, which they call postpartum stress disorder. A mental illness that comes as a result of change of hormones in a woman's body after they have given birth. Not every woman who gives birth gets postpartum depression, but there are very many who suffers from postpartum depression because they are women, because they have given birth. The cycle of pregnancy. Safari, my second-born daughter is 3 years. My first-born daughter is 19 years. So it took me 16 years later to get pregnant. And the roller coaster and the emotional spin I went through during the start of the pregnancy and pulling it off to 7 months was one of the most difficult time of my life. The hormonal changes, the different behaviors that come, and then the sudden change in lifestyle. You can't jump on a bike to go to the field. You can't travel long distance to.
You still have to maintain your work.
And you still have to maintain your work.
Wife,
you,
as a mother.
Exactly. You have to work. You wake up this morning, you don't want to go to work, but you have to work. You have a big number of staffs that are depending on you. You need to provide direction. So the mood swings, the changes in behaviors, the changes in body shape, and then the fear of what takes place inside the labor room, all that puts women at risk of mental illness. Then domestic violence, several numbers of violence that women face, physical abuse, emotional abuse, financial abuse. At workplaces, I interact with colleagues at workplaces, and there are so many women who are working because they feel it's a favor being given to them to work.
It's a gift.
It's a gift. And I'm like, hell no, it's not a gift. You deserve it. You qualify.
You worked for it.
You worked for it. Nobody will employ you if you don't qualify for the job. It would be a favor, but the favor has come because somehow, somewhere, you have a little level of qualification or ability to do that. So all these are some of the factors that makes women become more prone to mental illness. And if I narrow it down to Uganda, unfortunately, we don't have specific statistics that pull out women in regards to mental health. But
particularly doing a survey on women and mental health.
Exactly, coming with it. I would challenge you guys, your Center for Policy, you should be able to look. Yes, you should be able to look at that.
And work on it.
But if I draw from the experience of our implementation as TPO organization for the past 30 years, I can tell you that 82% of our service consumers are women and girls. And not because that we target them, but because that they are the ones who are readily available, they are the ones who always come up, they're the ones that always show up for help, and they're the ones that have the biggest number of problems and challenges that they're faced with in terms of psychological distress.
And also in a society where people do not understand mental health, so by the time they are coming up, it's actually the extreme bit. They have realized it.
Exactly. You find a woman has low self-esteem, a woman is contemplating suicide, a woman is thinking low about themselves, they're taking all the problems of the world as themselves. A woman is staying in an abusive marriage.
That can't live.
Can't
not
live.
Allowed to talk about it.
They can't tell anyone because maybe I'm fear of my friends judging me, or fear of his family saying, oh, my family is saying this. So by the time they come up, there are layers of trauma and psychological torture that they've gone through, that treating one woman who has come up to ask for mental health services, takes the resources that can be used to treat over 50 men.
So we know that women shape families, women shape societies, they shape the children.
True.
That means they shape the people that come out to society.
Exactly.
So what would you tell a family member, a husband, and make them understand the impact of a woman having a mental health condition, maybe due to how they're treated, the environment around, and what impact it has on the children and what they can do about it to ensure that women have good mental health environments?
So we have a saying that violence breeds violence. If you have an happy wife, you have an happy mother, you have an happy sister, don't expect to have a happy generation. Don't expect to have a happy children. Even you, the husband, don't expect to be a happy husband. Because you'll come back home, instead of coming back to a paradise, you're going to come back to the devil's den. Why? Because women hold family together. They do not only have the responsibility of childbearing, they have the responsibility of raising these children. They have the responsibility of taking care of the husbands. They have the responsibility of taking care of the larger family. So if they're psychologically unwell, all that is going to be impacted on everybody that they reach, everyone that they reach. There will be a bit of dividing right from the youngest child, even from the child in their womb. They'll be able to divide it up to you, the man, the brother, the father, or the husband that lives with them. So to be able to address the mental health crisis of this country, we need to pick a specific attention to address the mental health of women. When a wife is happy, even when a husband comes back home as angry as a lion, the lion will be calmed down. It will be softened. There will be a soft landing. They will have a listening ear. They will be able to have their problem solved. But when you can't speak, you can't talk to them, then there will be issues. And women are reactive. Women talk, women express. So let's start to listen. Let us stop guilt-tripping women by saying that you're too emotional.
When they are communicating.
Yes, you're too reactive. You're overreacting. You're misunderstanding. Listen to their communication. It might come to you as being too emotional, but that is her communicating that she's unwell. She doesn't like what is going on. So let's stop guilt-tripping them. Let us give her listening ears. Let us pay attention to the communication that comes from women. Secondly, let us be there. Just be there.
Be present, male involvement.
Be there. The husbands, we don't need you for money. We don't need you for childbearing. And we don't need you for on a public shows. No. Be there. Come home. Sit in the evening. Ask me, how are you? How was your day? How are children?
How are you managing?
Yes, how are things going in this house? But don't just show up, take a shower, sleep, making a routine, go, come in. No, be there, be available, be present.
Thank you very much. So we are going to take a short break and we shall be back.
You are listening to the Policy Digest, a Center for Policy Analysis podcast that explores how African societies are governed and how people and their leaders are shaping the future of their communities.
Welcome back. And as we were still discussing mental health, so for someone who's watching or who is listening in, and from what we have talked, they have maybe realized they may need help, or they have said, I think this is me. I think they have described me. What is the first step can they take to get help?
Thank you. Thank you, Safari. I normally make it very simple. The first step to seeking help is the realization that I need help.
So they've taken the first step already.
Yes. So when you realize that something has changed, you no longer sleep as well as you used to. You're either sleeping more or sleeping less. Your appetite has either dropped, you have this sense of feeling of you don't feel well about yourself. You don't, your interest in the things that you used to enjoy has dropped. Your self-care is poor. Your interaction with people around you is not so well. Some people could even be going through the extremes of having to feeling of self-harm, or the feeling of life is not as well as it is. I'm better dead, and thinking of what can I do that can take my life. There are others that have the extreme of what we call hallucinations, like either hearing or seeing or feeling things that are not there. You feel like there are things touching your skin, but they're not there. I might say they're not there, but it is true. It's a real symptom of mental illness. It's hallucination. It could be physical, like you feel like something is moving over your skin or touching you. You're hearing voices commanding you. You hear people speak to you or command you or sing. Or you see things, you're seeing things that do not exist. All these are signs of. So if you have some of these, if you feel that you're experiencing one or two, or you feel there's been changes in your life, the first thing I would encourage you to do is talk to someone that is not you, and somebody that you trust. You could just let them know that I don't feel well, maybe I need to see a doctor. You don't have to give them details. Mental health attracts a lot of judgment and stigma. So you really don't have to. If it's your boss, just ask for a day off to go to the hospital. If it's mom, just tell mom and dad that I think I need to go see a doctor. I don't feel well. So just reach out to someone. Reach out to somebody first, seek help. Secondly, there's help. There's really help out there. There are very many NGOs that are out here to provide support. For example, where I work, we are in about 29 districts. All those districts where we have psychiatric clinic officers, we have clinical psychologists, we have counselors and social workers who are ready to help you. There are also hotlines for calls that you can call. I know that one organization, Strong Minds, has a hotline. If you dial 256, it takes you to a call that you are able to speak to a counselor or a psychologist online, and they can be able to support you. But also walk to any hospital, Right now, the healthcare is improving. Even the general practitioners who are not mental health specialists, they will be able to listen and prescribe and make for you the best, good referrals of where you can be able to go. But most importantly, if you can take anything, I need you to know that mental health is something that is, mental health disorder, is something that is treatable, it's manageable, and you can be supported and you can recover and go back to functioning as a normal person. It's not a weakness. It's not a lack of strength. It is not only for the rich people like we put it. It's for everybody. So seek help.
So, thank you. Where you mentioned that if I just tell mom that I'm not okay, then I go to the hospital. I just tell my boss that I'm not okay, I go to the hospital. Doesn't that go back to the already stigma that is there? Doesn't that call for the need for enlightening? Because I'm imagining a 15-year-old, a 14-year-old, they most probably maybe don't have the money to even start. They don't know where to go. Isn't that a gap for Uganda as a country, that there is something we are missing? Because I'm thinking I'm supposed to be able to tell my parent that, Dad or Mom, look here, I'm having this problem, I'm getting these symptoms, and they're supposed to treat it like any other disease, like the reaction that they're supposed to have of malaria. Let us go to the hospital, instead of saying, I'm going to quote in Runyankore because it's a language I speak. Like you are being pampered, or you are misbehaving, or the perceptions that they take it in, or you modern spoiled children of the way you're reacting. Don't you think it goes back to the stigma that is already there?
I'm happy that you've brought the aspect of stigma. That's why I earlier on said that you don't have to give details. My first statement I said is that be available, be there. Now, you who is experiencing these challenges, you don't need to give details to the person that you don't feel comfortable with. What is important is to just come and say, Safari, I feel unwell today. Are you able to maybe help me drive me to the hospital? Or where colleagues say, Safari, I am unwell. I don't feel so well. Kindly step in for me. I would like to go and see a doctor. Or that child who is struggling, just say, Mom, I don't feel okay. Can we go to the hospital? And I want to encourage parents, caregivers, and guidance who are out there. When the children do not want to disclose much, do not push. When a child says, I'm unwell, I really want to go to hospital, I think just allow them to go to the hospital.
Give them the support.
Give them the support. Take them to the hospital, be there. Severally, my daughter, we seated out when she tells me, Mom, I'm unwell. I want to go to hospital. I tell her, let's go. Her insurance card is with her. So when she feels unwell, I encourage her, go do general checkup. Okay? Go do general checkup. If you feel unwell, ask your cousin who is here with you, go with her to hospital. If I'm here, let me drive you to hospital and you'll be able to get care. When we start to, unfortunately with children and adolescents, when you start to ask for too many details, you become intrusive.
They withhold.
Yes. And then when they feel you become intrusive in their privacy, they're going to hold back and say, you know what, don't mind about it.
I'm okay.
I'm all right. I'm fine. It's okay. Let it be. And they will be dying silently. So do not look at mental illness as a way of weakness, a way of laziness for the children, or a child looking for attention. Many parents, when a child says, I'm unwell, and then they ask them what's wrong, and the child say, I don't know, but I just don't feel well. I don't feel happy. I feel sad. They start to say, you're showing up. You're pretending, or you're trying to cover up for what you've done. No, that is the real way they're feeling. And if you're lucky, they've told you that they don't feel happy, they feel low, it's even the more reason for you to immediately go with them, take them to the hospital. If you don't know any mental health person, you don't know any place, just go to a hospital.
The doctor will help the child.
The general medical practitioners will help the child because they will listen to what the child is presenting with. Definitely, they will do their blood tests and but at the end of it, they will still point and say maybe the child need to talk to a counselor, or maybe the child need to take a break. Okay. So even for schools, there are many schools who hold children. A child comes and says, I have headache today. Tomorrow I have back pain. The next day it's my stomach. And they keep saying Panadol. No, make that child to receive care outside school. If you have a school counselor, refer that child to go speak to a counselor. But to those of us who might be suffering from any mental health crisis, I want to say that it's about you. The people who are out there do not know how you're feeling.
You know how you
But you know how you're feeling. Safari, it will be a story for another day if you invite me. I went through postpartum depression when I gave birth to my second-born daughter.
Sorry about that.
My elder sister was able to recognize it because she knows me so well. And when she saw I was changing and things, she started to make efforts. For her, she wanted to see her old little sister back, but I was struggling. The people out there will not know what you're going through. The people out there will not understand the voices speaking in your mind. The people out there will not understand the conversations that you're having with the physical hallucinations that you're having, or the tactile hallucinations that you're feeling, or the feeling of sadness, the feeling of you feeling like life is worthless. I am better off death. They will not know. It is you. You're the only one who understands it. So I encourage you, take the step to seek help, regardless of who will judge you, regardless of who will say what. Last year, around October, when we were having Mental Health and the Law Summit, I was very proud of our Minister for Justice and Constitutional Affairs.
Yes.
He stood in front of hundreds of people and said, I recovered from depression. I suffered a mental health disorder. I was put on psychotropic drugs. I saw a psychiatrist for months. So it's not about me. It's not about Safari. It's about you, the person
that is experiencing
the illness. Let the people judge you. It's up to them. Let them stigmatize you. It's up to them. But what is important is the way you are feeling. You don't sleep at night. You feel bad about yourself. You're even thinking of how to pick that poison and drink, or how to, you're thinking of what you should do to be able to take your life. Your mother will not understand. Your husband will not understand. When I went through postpartum depression, my husband didn't pick it. He's a very supportive, available, caring man. And he's very sensitive to my emotion because he has known me for over 14 years. But he didn't pick it. Later on, when he learned of it, he felt terrible. He told me, why didn't you tell me? Why didn't you tell me about it? The people I had in the house, they didn't understand. They just kept saying, she locks herself in the room. She's moody all the time. And mine came with, I would want to be in my room all through the day without brushing, without bathing.
And not being around people.
I don't want to get out. So it's you who feels it. Someone out there will not be able to. So I encourage you to look away from the stigma. When you call me dirty, it's okay. I'm dirty because my body doesn't feel like taking a shower because I am sick. So I'm going to go and seek help so that I come back
when I'm clean.
So
you've talked, if I seek help, most people are going to ask, how does the help, they want to envision what the help will look like.
Mm-hmm.
They've had terms such as therapy. Others go and have therapy. Others go and they're put on medication. All those forms, if I go to a counselor or a psychiatrist or a therapist, walk us through the possible medications or the ways they may help us.
Okay. So treatment for mental health disorders, there are several of them. We have mode of treatment. We have what we call psychotherapy. That is treatment without medication. And then what we call pharmacological, that is treatment with medication. So when we are looking at mental health disorders, the treatment of mental health disorders, you must first be assessed. What we call the tests in local language. You have to first go through tests. So there are assessments that are done, there are psychiatric evaluations that are conducted. And when that is done, the understanding of first, which of the many mental health disorders you could be having or you're having. Because each of these mental health disorders have different mode of treatment. Okay?
Yes.
So when they understand which of the mental health disorder you have, they also have to understand the levels. Are you in the mild? Are you feeling, is it mild? Is it moderate? Or is it severe? Mild meaning it's minimum. Moderate, it's in between, you're still functioning. Severe meaning it's really affecting you very seriously and it's now affecting a lot of your abilities.
Of your daily life.
Of your daily life and multiple aspects of your daily lives. So when they understand that, they can either put you on psychotherapy. Now, what they call therapy, this is talk. It's talk therapy. You sit with a professional who takes you through understanding what you're going through and then using scientific intervention to be able to help you. In most cases, mental health is a sickness of the mind that affects the body. So these scientific interventions are used in therapy to help your mind, the process of your mind and what is thinking and what is happening in your brain to change so that it translates in the improvement in your behaviors. Now that is psychotherapy, that is talk therapy. Then the medication, there are very many medications. There are very different lines of medication. We have oral medication that you can take. We have injectables that you can be given by injection. We have medication that can be dropped in food or in your drink. Okay. And we have medication that we call electroconvulsive therapy. I've not seen it in Uganda that much, but I started my mental health practice from Kenya for about 5 years. And in the hospital where I was working, we would do electroconvulsive therapy. This is treatment that is given to people with severe depression or severe psychosis to help their brain recover fast. It's for very severe long-term illness now.
When it's very severe.
Yes. Now, all these are different kinds of treatment. Now, the medications that are given to you also, they are of different generation. Okay, when I say different generation, what's the best word I can use? They are of different years. We have generation 1 medication. Those are medication that are old. Then current generation. So they are also different depending on what the sickness that you have. One thing that I must say is that everything good has a negative impact.
So even the medication has a negative impact?
So some of the medication have side effects, but the side effects, they wear off with time.
What are some of the side effects?
Part of the side effects for being put on maybe on antidepressants could be increase in weight. Okay? It could be increase in weight. It could be too much sleep or loss of sleep. It could be too much appetite or loss of appetite. Okay? We have some antipsychotic medications that you are given. They can come with causing pain in the limbs when you're injected. Some of the antipsychotic medications, they can also give stiffness of the neck, and they may maybe change the postures of if your head is straight, they could change it a little bit, but they're temporary.
They're not permanent?
They're not permanent. Those side effects are temporary. They're not permanent. They wear off with time because it's the process of the drugs working and supporting your mind and your brain to stabilize. You know, we have neurotransmitters. For a lack of better word is electronic wires in our brain. The brain has different parts. We have different parts of the brain. And each part of the brain does a specific kind of work or a specific kind of function. So they use the electronic wires or the neurotransmitters are the ones that connect communication between the different parts of the brain. So when one part is not working well, that's when you see the impact being affected. So those drugs help to normalize the body and normalize the function of the different parts of your brain. And then now the impact is seen in your body and in your behavior.
So the effect is just like for any other medicine of any disease.
Yes.
So if I notice that I have a mental health disorder or condition, but then maybe for the different factors, stigma, failure to access, all those other factors, and I do not get the help, what am I risking? What could be, I don't want to use the word end game, but what could be the end game of what extremes am I risking to face? Let's say I have noticed I have depression. Does it increase in case I don't get medication or help? Does it increase, or one may ask, can it go away without me getting medication?
This is how I want to start. The best way to deal or to manage a mental health disorder is early intervention. In my practice, clients who have started intervention at the early stage of them discovering and realizing that they're unwell, the prognosis is very good. The chances of recovery and gaining functionality and living normally, the chances are very high compared to when a client has been sick for a very long time. They still recover, but the prognosis is poor. The prognosis is not as good as the one that came in for early intervention. So what I would encourage is, if you feel unwell, the earlier the better. There's a lot that you risk. Mental illness is a disease of the brain that now affects you and you entirely as a human being. Your behaviors, your function, it affects. So when you sit and you don't seek help, you're risking your physical health. You're risking your general health. Because when you have prolonged depression, you're going to develop weaknesses. You're going to start developing migraines. You're going to develop general body pain. You're going to develop general health-related issues that you will not understand. You're going to develop unhealthy lifestyles. For example, drug abuse. You're going to start risking to do things that are causing more harm
to
your body and to your life. So you risk your health and your life as a person if you do not seek help. So please look out and seek help.
So what would a serious mental health response look like in Uganda? according to you? If we were to have a serious intervention, how would it look? How would you want it to look, in fact?
Safari, I like your choice of word, serious. Okay,
Yes.
so I would want to say a good functioning mental health response program in Uganda, how would it look like? I would say, let's have systems in place. And when I say system in place, let's have the right personnel placed in the right places. Can we have psychiatrists, psychiatric doctors at all regional and district hospitals?
Yes.
Can we have psychiatric clinical officers at sub-county health centers or offices? Can we have nurses, psychologists, and counselors at the health centers? Okay, that way, that is a system that is working, starting from down up. That's a working system. Can we have the right personnel placing? Can we have the right professionals in the right place to be able to guide and support when care is needed? Right now, we have a very fragmented system. Minister of Gender is doing their thing, Minister of Education, Minister of Health, civil society are doing theirs, development partners are doing like UNHCR, UNICEF, everybody's doing their own thing. So a world system for mental health response, other than having systems that are working, having available personnel placed in the right place, having access of services at the respective, at least at worst, let's have it at health center 4. At least have a counselor somewhere. The other thing is coordinated resources. When Minister of Health is doing something, coordinate with Minister of Gender, Minister of Education, so that there is no duplication.
Of the same thing. And which is not even like quality.
Exactly. So you find now for us civil societies, we are torn in between. What you've supported a year ago in this ministry, you again find another ministry has the same interest, and you're like, but there is this going on here. So a coordinated system that would be help. And then legislations. Let's have clear legislative policies. Let's have the policies. Let's have the guidelines. Let's have the documents. Right now, the Ugandan Penal Code puts suicide as a criminal act. So you sit and you ask yourself, how do you even start to arrest someone who is
attempted
sick
suicide?
And put them in jail? When you go to prison, it's alarming. We have so many people who have committed offense during an active episode of a mental illness. Okay, when they're sick or they're depressed, but they're in prison. They're in Ruzira and in the respective prison systems of Uganda. So a good system. Let's have the protective documents. Let's have the policies that helps. And you guys, the human rights people and the policy, we need to be able to task government to set forth. In East Africa, there are a number of countries that have made strikes. For example, Kenya. Suicide is no longer a crime in Kenya.
So we should take the same path.
So we need to look at revising some of those old policies that still put human rights issues like health. Health is a human right issue.
And it is put on the sideline.
Yes. So putting it still as a disease is not right. And then most importantly is awareness. Let government and everyone else create a platform for conversation, for communication. I like what they did with addressing HIV/AIDS, not only in Uganda, but globally. Let's take that direction. Let's normalize the conversation.
So that it's not news to people, it's not new.
No,
and they are able to understand it.
And it's not an isolated discussion, it's not an isolated conversation. That way we can be able to, we would say that at least we have a system, we have something that is working. Not the best like you've asked, but something that is working.
We actually just let them first give us something that is working, working thing.
Yes.
I think you're right, because our laws lack so many. Mental health is really sidelined even in our laws. So I think you're very right about that. Yeah. And I don't think it is right for me to fear to tell my boss that I'm going through mental health. If it was already a conversation that they have had and the stigma has reduced, I would not have the fear on my
You shouldn't be afraid of losing your job because you have depression. We have people who are suffering at workplaces. They're struggling with drug abuse, alcoholism. Where I work, I don't judge people for substance abuse. When I notice, my first question I run is what is going on. I don't look at the drugs. I don't look at the abuse. I don't look at the alcohol. I look at what are the issues that is dragging Grace to excessively drink and even appear at work looking saggy, looking dirty. So there are many people at workplace who are even afraid of saying, my wife beats me at home, or my husband beats me at home, because they think that when they get to know that I'm struggling with a mental health challenges, I will lose my job, I will lose credibility, or I will lose my position. It's not right. So let's normalize the conversation. Let's set structures for care and support.
And regulations that
support. And not only even the Constitution, even the Workers' Association, the labor laws. Yes, can we include an aspect of protecting the rights of workers? Mental health is a person's right. So can we be able to set that so that it is regulated? Whether an institution wants it or not, the structure is there. The structure must be there and the support has to be there. It has to be my right to say, you know what? I'm undergoing treatment for bipolar. I would want to take leave, but not my annual leave, but sick leave of 2-3 weeks. And I shouldn't be penalized for it. But there are institutions that will not even give you 3 days of sick leave.
When because they know that it's depression.
Yes, it's depression. We don't understand it. Or it is alcoholism. It is your own problem. Why are you drinking excessively? But it's a sickness.
Thank you very much. Yeah. I've had such an engaging, educative, and awareness conversation with you. Is there anything, a last message you would want to tell any person going through a mental health condition as of now, or any person close to them? Because there's even when I do not notice that I'm going through a mental health condition, but my neighbor has noticed. Any last message to them?
I want to conclude by saying that dealing with mental illness is not just the responsibility of the person undergoing.
Yes.
Mental health affects an entire community. It affects an entire family. When you have a child who is struggling with depression, it's going to affect the mother, the father, and the siblings in the house. The financial impact is going to scale on everyone else. Even it's going to, if you look at the reduction of labor in this country, it's highly attributed to poor mental health. People, when you have a poor mental health, people will not work. Yes, people will work, but will not be productive and fruitful. And I tell people that bigger percentage of Ugandans work, but it's not productive and fruitful work. Productive and fruitful work is work that gives revenue, is work that pays taxes. It's work that improves system.
And you can see it.
And you can see, and in Uganda, we don't have that. There are very few who do that. So addressing mental health challenges is not about the person who is sick. It's about all of us. Because you, the brother, the sister, the husband, you're also going to feel the impact on yourself. It's going to weigh on you. So let's collectively take responsibility and watch out for each other. Let us seek help. But most importantly, let us know that health starts with mental health. There is no health without mental health. If you don't address your mental health, like I gave the definition before, then you're not a normal human being. You're not going to be functional. You're not going to be a normal person. So your life as a person starts with mental health. So look into that.
Thank you very much.
Yes.
Thank you very much for watching. As Grace has said, there is no health without mental health. This was the Policy Digest. And follow us on all our social media platforms at SEPA Uganda on TikTok, YouTube, and X.
Thank you for listening to the Policy Digest podcast, the Center for Policy Analysis podcast that is profiling African ideas and people that are shaping the future of their communities. Subscribe to all our platforms on YouTube and Podbean.